Welcome back to the Vitals Podcast. I'm your host, Chauncey, back yet again to digest and bring you the latest in medical news today. It is Monday, June 24th, 2024, and I have some more discoveries for you today. But before we start, I apologize that the Discord link did not work before. It works now on each episode, including this one. As always, don't forget to follow the podcast and share it with your friends to keep everyone you know in the loop. Our first story comes from Dr. Shah and other experts at Stanford Medicine Children's Health, where trials were conducted for a new gene therapy to treat X-linked ALD. Your nerve cells, or neurons, have a fatty sheath around them to protect them called myelin. This myelin sheath also insulates the cells, allows the message to travel quicker through it, and helps the cell maintain the strength of its electric impulse. ALD, or adrenoleukodystrophy, affects around 1 in every 17,000 people, and it happens when these myelin sheaths break down. It's a genetic disease found in the X chromosomes. Remember, females have 2 X chromosomes while males have 1 X and 1 Y, and it presents most commonly in children. Because men have only 1 X chromosome, if a boy's X chromosome has a mutation, the boy will have ALD. But if a girl's X chromosome has the mutation, as long as her other X chromosome is healthy, she will only be a carrier. This means ALD is more common in males. According to Stanford Medicine, catching the disease early is important to help manage the symptoms, as there is no known cure. These symptoms can include paralysis, muscle spasms, coma, seizures, strabismus, and hearing loss. Strabismus is cross-eyedness. As far as potential treatments go, a typical stem cell transplant treatment sees a donor donate a piece of healthy bone marrow, which is transplanted into the patient, providing new, healthy cells that could halt the disease. However, the treatment requires chemotherapy, and there is the risk of GVHD, or graft versus host disease, where white blood cells in the donated bone marrow would start attacking the host cells, or vice versa. The potential treatment, called elivaldagene octatemsel, or as it's marketed, Skysona, instead removes the patient's own stem cells, adds the missing gene, and reintroduces it into the body. Less chemotherapy is needed, and the new stem cells are originally from the host, which nullifies the threat of GVHD. It passed clinical trials of 57 patients and is ready to be offered as treatment. Similar gene therapies are being adapted and approved for beta thalassemia, when your body makes less hemoglobin, the oxygen-carrying molecule than normal, and sickle cell anemia, when your body has a hemoglobin mutation that misshapes red blood cells. The difference between typical stem cell transplant and this new stem cell gene therapy is almost black and white. The Escobedo family of Colton, California had 2 sons, Israel, the older son, and Ivan, the younger. Both were born with CALD, or cerebral ALD, the worst form of ALD. When Israel needed treatment, doctors gave him typical stem cell transplant. The chemotherapy to prepare him for it debilitated him, and he needed physical therapy afterwards. His immune system suffered as a result, and he kept getting infections and GVHD. In the end, he survived, but it took a toll on him and the family. When Ivan was born and eventually needed treatment, the family was recommended to stem cell gene therapy in his clinical trial. Ivan needed far less chemotherapy and had bounds of energy during treatment and had far less complications related to the treatment. Both boys are happy and healthy today, but it goes to show how much better for patients this new treatment may prove to be than what we have now. Our second story comes from Dr. Wyndham H. Wilson and Dr. Christopher Melani and their team of researchers at the National Institutes of Health, who have developed a non-chemotherapy treatment regimen for people with aggressive B-cell lymphoma that has come back or is no longer responding to standard treatments. Your lymphatic system is a series of highways, or vessels, and pit stops, or lymph nodes, which aid your immune system in doing its job. In these lymph vessels and lymph nodes are, you guessed it, immune cells. Lymphoma happens when these immune cells over-replicate and don't die off in your lymph nodes, creating a tumor. Typically, doctors treat it with chemotherapy or radiation, but Dr. Wilson and his team may have developed a new, exciting cure. In a clinical trial at NIH's National Cancer Institute, researchers tested a combination of 5 drugs in 50 patients with the most common type of lymphoma. The drugs were, and I apologize in advance for butchering all of these names, venetoclax, ibrutinib, prednisone, obinutuzumab, and lenalidomide, called Viporr together. This 5-drug combination targets multiple molecular pathways that diffuse large B-cell lymphoma tumors, or DLBCL tumors, used to survive. The treatment shrank tumors substantially in 26 of 48, 54%, of evaluable patients, with 18 or 38% of those patients' tumors disappearing entirely, known as a complete response. At 2 years, 36% of all patients were alive and 34% were free of disease. They believe this is so because while 1 or 2 drugs may block a few survival pathways the tumor used, the combination of 5 drugs made it more likely that enough pathways were blocked to kill the tumor cells. Side effects of the 5-drug regimen were generally mild to moderate when compared with those of standard treatments, and the side effects improved during the treatment breaks. Only 5 patients had to stop treatment early for various reasons, including side effects. Given these relatively mild to moderate side effects, additional drugs could potentially be added to Viporr to improve its efficacy, the researchers said. The team is also studying the Viporr regimen in people with other types of lymphoma that are resistant to previous therapies, and they hope to open more trials to further production of Viporr. Now it's time for the Vitals, where I go in depth on what you need to know about topics of your choice. If you'd like your question to be answered, drop it down in the Q&A section of Spotify, and you may just see it in a future episode. This episode's vital question comes from Kings, who asks, what new developments are being made for amputees? Good question, Kings. Let's say we have a guy named Bob, and Bob was a part of a tragic car accident that ultimately led to the amputation of his right leg above the knee and left arm at the elbow. Without some type of aid, Bob can't run track, play piano, or even walk like he used to. In comes prosthetics. As of now, Bob has a couple of options. There's the most common above-the-knee prosthetic, which has a socket that straps to where the limb used to be, an artificial hinge joint, a robust beauty of engineering where the shin would be to provide stability and durability most similar to a human leg, another joint, and an artificial foot. This is what will pop up if you search above-the-knee prosthetic leg. Bob controls it through electrodes in the socket that sends electric signals in Bob's leg. Now, this design can be optimized through many different ways. For one, and you've probably seen this, there are performance prosthetics. Bob runs tracks, so he might get a prosthetic made for just that. Again, it has a socket for his leg, but no joint, and the rest of his leg is a bent piece of metal that looks like a curved L. It's meant to bend and flex with the amputee's weight, helping them push forward as if they had a calf and ankle. For one's leg, a person really needs control over their knee, their ankle, and their metatarsophalangeal joints, the joints between your toes and your foot, to do most things. For one's arm, Bob may need a prosthetic he has more control and autonomy over, especially if he plays piano. That means he needs to be able to control his elbow, his wrist, his metacarpophalangeal joint between his fingers and his hand, how his forearm rotates, and the joints all in his fingers. That's where MCPs, or mind-controlled prosthetics, come in, hooking the prosthetic up much more personally to Bob's nerves and brain, allowing him to control it with his thoughts. Along the same lines, sensors can be placed along the prosthetic to create a sensory feedback system, so Bob can really feel what he's doing. For general prosthetics, one option may also be osseointegration, which requires surgery to implant the prosthetic into the amputee's bone, which gives the amputee even greater range of motion, comfort because there's no socket, and more autonomy. Researchers are even exploring regenerative therapies to help amputees adapt their remaining tissue to the prosthetic, or, if the technology becomes advanced enough, grow back what was lost. At this point, the sky is not the limit, space is. We'll just have to wait and see. Thanks for the question, Kings. That's all for this week's episode, so thank you for tuning in. Follow the podcast and share this episode with your friends. If you'd like your questions answered, remember to drop a response in the Q&A section of Spotify and you may see it in a future episode. Remember to join the Discord. The invite, which is fixed now, is in the description below. Until next time, keep your vitals strong and your spirits high. This is your host, Chauncey, signing off. Take care and stay healthy. I'll see you next week.